Hi everyone, and thank you for coming to my presentation, Educational Materials to Prepare Patients for Wildfires. My name is Serena Blacklow, and I'm a fourth-year medical student at University of California, San Francisco, or UCSF. I'm really excited to share this work with you that I've done in collaboration with Raj Fadadu, Dr. Catherine Gunling, and Dr. Ariane Tirani at the UC Center for Climate, Health, and Equity. So to start, climate-related events such as wildfires are increasing in frequency and intensity, and as you know, they have widespread effects on physical and mental health, for example, increasing hospitalizations for asthma, increasing preterm birth rates, and increasing rates of post-traumatic stress disorder. At UCSF, we did a needs assessment to see what educational materials exist. We found that very few clinics have any sort of materials. We found that educational materials that are existing are mostly websites and pamphlets which are really wordy and not interactive. And then no studies have evaluated how effective these materials actually are at communicating the health risks or actions patients can take to mitigate their health risks. So we decided to create infographics with the user experience in mind. Here on the right is an example of a general infographic that we made that could be posted in a primary care clinic, for example. It's divided into 3 sections. What is wildfire smoke? What can the smoke do, or how does it affect a certain organ, and then how can we stay safe? So we did a primary literature search to come up with what to put the content, and then we also organized it by organ system. So down here are examples in mini of graphics for different organ systems like lungs, heart, skin, pregnancy, mental health, and we also have a pediatrics one. In order to design them, we looked at something called the PMAT, which is a Patient Educational Material Guideline, and then we also looked at user design guidelines from the FDA, and we asked questions like, is this understandable, such as using 6th grade readability? Does it use audio-visual aids such as illustrations? Is it inclusive in terms of accessible in different languages? And then is it actionable, such as including links for further action? So if you look at ours, we have some illustrations, and then we have these QR codes. One that goes to the UC Wildfire Education Hub, which is actually where all of these are housed and publicly available. That's climatehealth.ucsf.edu. And then another QR code that's more specific to the infographic itself. So this one is more general at the EPA, but for lungs, for example, it'll connect to a more lung-specific website. And then we encourage you to go to that website, climatehealth.ucsf.edu, and download these yourselves, and then post them in the appropriate setting, whether it's clinic or in an after-visit summary, or handouts in some way. So in the future, we'd like to do a patient survey to evaluate how effective these infographics might be. For example, questions we'll ask is, did you learn something new from the infographic? Did you scan a QR code? Is the information clearly presented? Do you feel represented or included in the infographic? And then finally, is the infographic even the right thing? Like, how would you like healthcare providers to communicate the health effects of wildfires with you? For example, using posters, an app, a waiting room video, in-person conversation, or, of course, infographics. So thank you so much for listening. I'm happy to talk further about this project or anything else. This is my email, serena.apignani.blacklow@ucsf.edu. Thanks so much.